Hi, I'm Natalie Sandhouse. I'm doing my communications speech for demonstration, and this is my husband Chris. He's my participant, and I have my friend Jackie as my audience member. Have you ever been to an emergency room or stayed in a hospital? If so, one of the first things they probably did was give you an IV. Many patients are afraid of IVs, but there's nothing to worry about. In the hospital settings, you get an IV to give you medications, to hydrate you, or in worst case scenarios, to give you blood. There are also off-site freestanding clinics that will give you infusions out of your own pocket, not billed to insurance, that are vitamins or hangover cures, and those are also run with a doctor on site as well. I've worked in the clinic setting giving IVs to patients on a daily basis with medications through their IV. I'm going to show you the process of getting an IV so that you have a better understanding of what your nurse is doing, so that when you have an infusion in the future, you won't be as apprehensive to get it. So first things first, you would get a doctor's order, or your nurse would get the doctor's order. Now, you may not see the doctor's order because this is normally a communication between the doctor and the nurse, but your nurse would then come in and let you know that this is what the doctor has ordered. After that, your nurse would come in, either have the supplies sent to her from the pharmacy if it's in the hospital setting, and she would bring everything ready to you, or she would bring things and prepare them next to you. I'm going to show you a quick process on how to do that. So behind me here, I already have an IV bag. This is just normal saline, and here in this little port here, you can get, that's where they can add medications in. In the hospital setting, in most cases, the pharmacist will send the IV bag up to the nurse with the medication already in the bag. In the clinic, the nurses do it. So I'm going to put on gloves so that it works nice and clean, and I'm going to get my IV tubing. So this is the tube that will take the saline from the bag to you. And I will put this into the saline bag. And fill it up with saline all the way to the tip, so that there's no air bubbles. So no air bubbles will go between the bag and the patient or you. And then next, your nurse would also take a look at your arm by placing a tourniquet on the arm. That will tighten the blood vessels and keep the blood flow going down in this direction. I'm going to have you hold your arm upward like this, and she will feel for veins. In this case, I see a really good vein here. It's not going to be painful to the patient to go in, maybe just a little stick. So first, your nurse would then clean the area with alcohol and get the needle. So this is a needle, and it has a catheter on the end of it. And in this area, right below the needle, is where I would get the indication, or your nurse would get the indication that she's gotten into the vein. And then up here, there's a needle with a little tube around it. It's kind of like a straw, tiny little straw. And that is what stays in the vein, and the needle comes out once we're in there. So your nurse would normally like to warn you, hold the tight area tight, and warn you, say, I'm going to give you a little poke. Go straight in, see the flashback, and then just push the catheter forward. And as you can see here, there's blood. So immediately I'm going to release the tourniquet. And going to hook this to this little tube here. I'm going to hold pressure here and just pop that needle out and press that in here. Now, what your nurse would probably do is then just flush it with saline and make sure that it's not painful. So, can you feel that? All right, so nothing to feel. You can see the saline going in. Next thing you want to do so your nurse would put this on the site to make sure that it's holding it in place and also that the IV site is present and visible to make sure that there's no infections happening. That is one of the side effects of getting the infusion and breaking into the skin is there's possible risk of infection in the area. After that, it's as simple as just switching out one saline for another, twisting that on, starting it with a lovely drip right here. Some settings use a gravity setting. You can change the rate of the drip with this, which is up to your nurse and the doctor's orders that are given to her on how fast to get the infusion. So, now that you have seen the process of getting the infusion, you may not be as apprehensive to getting one in the future. You know the process of getting an IV. I've had patients come into my clinic and they were totally freaked out about getting an infusion. And it's mostly because they didn't know what was happening. So I was happy to tell you today how the process is of getting an infusion. And in the future, you may not be as weary and you can be more at ease. Thank you.